The number of people undergoing genetic testing to see if they're at a higher risk of developing Alzheimer's is on the rise.
Marianne Rafferty explains the driving factor.
Million people in the U.S. have Alzheimer's, the most common type of dementia. The Alzheimer's Association says that number is expected to increase to roughly 13 million people by 2050. And while the National Institutes of Health says there isn't a single cause of Alzheimer's, your genetics can play a part.
I had the constant fear that, oh, it's good, I'm next.
After losing her mother to the disease, Wendy Nelson took a 23andMe DNA test to see if she had any copies of ApoE4, a gene variant that can increase a person's risk of developing Alzheimer's.
It comes up with very dramatic. You have 2 variants of ApoE4.
With each copy of the ApoE4 that you have, that not only increases your risk of developing Alzheimer's disease in later life, you tend to develop at a slightly younger age.
Pretty devastating news to learn.
While Nelson's results were not what she wanted, knowing her risk factors is giving her time to plan for what could happen in the future. And according to health data company Truvada, more Americans are following suit, citing how testing for ApoE4 is on the rise. Some doctors believe more people want to get tested because medical breakthroughs are showing signs of slowing the progression of the disease. The makers of the drug Leqembi say it's been shown to reduce the rate of cognitive decline in patients with mild Alzheimer's by 27%. The National Institutes of Health says up to 25% of people in the U.S. have 1 copy of ApoE4. Up to 5% have 2 copies. Marianne Rafferty, Fox News.